Hello, this is Tiana Schisel again here from Felician Village Rehab, and today I'm coming to talk to you about joint replacements, what that might look for leading up to surgery, what types of things your doctors might recommend after surgery. So leading up to surgery, sometimes doctors will refer patients for therapy to really make sure that they've exhausted all avenues of strengthening, balance training, prior to actually having a surgery, just to make sure that something else couldn't be done prior to making that big decision of surgery. Once your surgery is set, sometimes they'll send you back to therapy to really get a handle on your exercises that are going to be important to keep those muscles strong post-surgery. And then of course after surgery, literally sometimes just hours, therapy is working with you again, getting you up, getting you moving, especially if you have a hip or a knee replacement. Another common joint replacement we tend to see are shoulder replacements. That's a little different. With those replacements, we often aren't having the patient work on that joint right away. Instead, the therapist is going to move it for you. And that's called passive range of motion. It stops the patient from actively moving their muscles, but allows the joint to start to get loose for future weeks when we are able to get back to movement. Therapy also over the course of joint replacement can help you learn how to do those things that you do every day within the parameters your orthopedic doctor has set forth. So going back to the shoulder again, we have to figure out how are we going to get our shirt on if we're not able to move a shoulder. That's where your therapist, specifically occupational therapy, will come into play. If you have any further questions about a joint replacement, whether you're thinking about it or have had a history, please give us a call. We'd be glad to answer any questions you have.